Now, I'll tell you one thing. I've been watching, we're talking about time and range. I watched a conference via Twitter this weekend, and I saw something very interesting because when this time and range stuff came out, they allow up to 180. If you go into the,
Sorry,
not
180
the,
10 for people using our UK measurement.
yes, 10
10.
millimoles. Yes. So 180 or 10, that's a range, and they try to convince you that's a safe range. So that means, like, if you're a parent and your child is sleeping and they go to bed, it's 11 o'clock, and you check on them and they're 160, let's say, they're in range. Well, that range is double normal. And if you read literature, and I'm not talking about Dr. Bernstein's literature, I'm talking about ADA published literature. You read about the dangers of those blood sugars. There are microvascular dangers and there are macrovascular dangers. You don't get a free pass to health by running a blood sugar, which is double normal and 30% above that. And they're starting to recognize that. So now they've got a new phrase that they trotted out this week, and I'd never heard it before. I don't know who's responsible for it. It's called time in titer range. And now they're defining that as up to 140. And you read the papers that they're talking about, there's little sentences here and there that, yeah, you got to be careful of, because non-diabetics are not running over 140. They have some references and so on. So I thought, well, we should have a new phrase called time in normal range, which is like, I don't know, let's say it's 75 to 100. Okay. That's a pretty reasonable range. If you're following the Bernstein method and you're up above 110, depends on the context, but you're likely to, if you're really good at it, you're likely to correct that 110. You're not going to be walking around at 110. And if you're rising at 110, you're going to go, okay, I might be 120 in a half an hour. So I'm going to take a half a unit of insulin. And that's the control the Bernstein method provides for you. But they can never give people advice like that who are following their same advice to eat all the birthday cake they want and so on. Because if you do that, 110 is as good as it's going to get, right? So anyway, that's the new thing, time and titer range. You're going to hear more about that, and they're going to say, then they're going to throw their hands up and say, well, like we time and range is sort of reasonable, and but we do tell people if you can get in time and titer range, that's a good thing. And it's like, okay, at some point you have to tell people how to do that, right? Let's get curious about how other people are doing it. And the lack of curiosity is what I'm talking about. Why are these people so incurious and so quick to write off this method? And it's like, what do these people do in their like normal lives? When do they constantly like hit their heads against the wall, and anything in their life that doesn't work, do they not respond to any stimulus that could change things in a positive direction? I mean, it's like the whole thing is so bizarre, right? I say, diabetes, like once we got the book, I kind of figured out diabetes in about 2 weeks. But the real bizarre problem is trying to understand this industry that keeps insisting, from my vantage point, on sending people down the tubes over and over again. In fact, if you follow this method, you're likely to get harassed and threatened by your care team. It's a fact. People will get fired for eating healthy meals of protein foods and vegetables, using safe dosing of insulin, and achieving glycemic results that no other patient in the practices shoot for. And for that, you'll get harassed, threatened, and maybe fired by your care provider. It's just unbelievable.